Now, moving on to our first section, that is the management of trauma patient as far as the pre-hospital management is concerned. As you know, that the management on the scene is as important as the hospital management. In this section, we will be briefly discussing the etiology of major trauma, what are the different causes, what are the safety on scene and immediate action and triage which may needs to be done for taking the patient to a hospital. So what are the main etiologies? It is one of the injury top three causes of the death, along with other different causes as well. It may be a result of violence. It could be the most common usually it's the road traffic accidents with the no advent of cars, and obviously with the high speed cars and motorways, there is increased chances of having an RTA. And road traffic crashes are one of the very most common causes of trauma, or multiply injured trauma patients are polytrauma. Mortality is subsequent to the major trauma. If the multiple areas are involved or multiple viscera have been involved and it's a polytrauma, then there is a high likelihood of a patient dying from polytrauma than if only a single system is involved. Usually that depends on a country's economy. Obviously, in the developed countries, it's actually, although it's very costly treatment, but yes, they are spending it on their health, and that's why the patient's mortality is not that much due to polytrauma. But in developing countries, unfortunately, a lot of people die due to polytrauma reasons. There's a term called as injury severity score. Actually, it involves a scoring system which involves multiple areas in which the patient is actually scored accordingly. And if it has very high value, that means it's a very increased likelihood of patient having a high morbidity or high mortality. Now coming to the mode of death. That deaths from the trauma could be due to, usually they follow a trimodal pattern. Trimodal pattern means actually initially it was thought that there's a sudden death, that is the death on the spot. This could be due to many reasons. Then the patients may survive, they may eventually reach hospital, but they die within first few hours. Or then the third pattern mode was basically the patient has survived the initial few hours as well, but later on dies due to sepsis and multiple other causes and multi-organ failures over then from weeks to months. But now it's actually due to good amount of care from trimodal pattern, the patient actually the trend has shifted to bimodal. That is either they die on the spot or they die due to sepsis or there is a late morbidity or mortality. Usually this within the dying within the first few hours is actually has been massively reduced due to increased emergency medical services which has been provided, and there is increased efficacy of the trauma teams which have been developed by the different countries so that acute trauma care can be provided. So what are the type of injuries which can occur? These include central nervous system injuries. This could be cardiovascular injuries. Central nervous system injuries include base of skull fractures. Cardiovascular means could be cardiac tamponade, could be even injury as other injuries as well. There could be severe hypoxic injuries due to airway obstruction, or hypovolemic shock as well due to excess bleeding. There could be airway obstruction, as I just told you, or increase or a massive external hemorrhage. Maybe a femoral artery or a major artery has been avulsed and leading to massive bleeding. Now coming to the sequence of management. As you know, that trauma management is, although it starts like it's a mnemonic, a very famous mnemonic of ABCD, but you have to remember this probably ABCD is the crux of the whole management. We will be coming to this ABCD again and again and again. So the sequence starts, A stands for airway and cervical spine. So that is important, that effective EMS emergency medical services should be available before the hospital. Now in developed countries there are actually services which actually starts their patients management resuscitation before being actually patient arrives at the hospital. So it's kind of a time saving, plus it's actually helps, every second counts. The earlier the trauma resuscitation starts, there are increased chances of patient surviving. But if that resuscitation starts late, the patient may eventually will die even with the effective resuscitation. So immediate first aid maneuvers are required. Then again, as I told you, airway, A stands for airway and cervical spine, and then with the help of breathing, B comes for ventilation and and other modes of injury as well. So treatment is centered on evaluation, resuscitation, and stabilization. So the important concept over here is you have to remember that it's not a single man's job. It's emergency medical services are also a team, a group of 5, 6, or 10 people who are, one of them is evaluating, other is started the resuscitation, and other is stabilizing. So it's actually kind of a process which is occurring at the same time. So it's not that you evaluate first the whole patient, then you think of resuscitation, and then you stabilize it. It's kind of things are going in hand. Now coming to other the pre-hospital management, essential elements include organization. As you can appreciate, there has to be so effective legislation in place. There has to be different organizations in place with government so that they can effectively give emergency medical services to the trauma patients. Then need safety on the scene, including personal protection. For those who are actually caring for the trauma patient, for example, if the patient had RTA and then her car got on fire, so it's not just that he or she is having a problems with multiple fractures and maybe chest and head trauma. There's also a fire problem as well. So you need to make it sure that those who are actually rescuing that person are also protected and have enough equipment so that their life is not in danger. Then they should have some knowledge and enough skills to have immediate actions and do the triage if needed. Then assessment, and they must be effectively trained as well to have assessment and initial management to be done. Then how to extricate and immobilize a patient. Sometimes the problem is that in a car crash, this is actually the most common injury occurs when the patient is actually taken out of the car. And if they're not expert and they are not properly trained, there is always a chance of spine injury when the extrication of a person out of the trauma car. Then they should have a clear know-how to transfer that patient to the hospital, whether a helicopter or an air ambulance even. Because if hospital is far away, then probably they would require a helicopter or air ambulance, because that can make sure that the patient reaches hospital as quickly as possible. Now coming to the safety on scene. Trauma incidence is usually hazardous, but the important point is that those who are caring for the trauma patient, they should have a good idea that the patient is, for example, patient is in a burning car. First of all, that fire should be extinguished. Until unless if that fire is not extinguished, then it is probably not only hazardous to the one who is inside the car, the problem is could be for those people who are rescuing the patient, that person as well. So that is the important, is the safety of the people who are caring for it and safety of the person who has got injured as well. So if the scene is not safe, the patient or that person who has had a trauma must be moved away from the scene. Then is in a car, we have basically safety measures as well. Undeployed airbags which can be triggered. Usually airbags are not built in so that the maximum injury can be prevented during a car crash. Other use of personal protective equipment include safety equipment such as seat belt, which has been actually helped a lot as well. And actually the seat belt and helmet has reduced incidence of trauma way too low. Then the important point is that if those people who are taking the patient out, they should know whether there is unstable wreckage, jagged metal debris, or fire is there or not. And they should make it sure that executing that person who has had a trauma should not injure that person more than he or she has already sustained. Then important point is radiological nuclear protection, but that is usually only in the case of a nuclear fallout or in case of a nuclear war. Then coming to the immediate actions are triage, which they should be trained as well to take it up. Triage is a system for medical sorting to identify casualties in order of priority for evacuating and treatment. Now this is kind of it, you make different levels, you give them color coding is actually done for the triage, but this is done when there is a mass disaster. For example, there's an earthquake, and then let's suppose there are 50 to 100,000 of people who are actually suffering from a problem. What happens is that You cannot take care of each and every person, so you have to prioritize and organize yourself that those who are dead, they should be taken aside, and those who need the most care and they're going to be mostly benefit from that care acutely, they should be given the preference. Those who may be so severely injured that despite all the methods and resuscitation and all the efforts, they probably are not going to survive, so they are not actually on the priority list. They are way down on the priority list. So that is how we manage the best care, most care for the person who is going to most benefit from that care. So that is actually the triage. That is how it's done. It's a personal scene and casualty safety. Priorities are determined by the triage, and two-stage triage sieve or triage sorting is done. So what is a triage sieve? It's a quick and uncomplicated system based on simple clinical observation of casualty ability to walk, breathe, and maintain peripheral perfusion. If that is, it's a very simple way. You ask the patient if he or she can walk, means less likely to have a long bone fractures. He can breathe, less likely to have an airway compromise. And if he's maintaining peripheral vascularization, there's least likely to have a circulatory collapse or a hypotensive shock. Usually done by trained personnel. It's performed in pairs and for a usually a catastrophic hemorrhage. If we suspect there is a serious hemorrhage, then tourniquets, although it can be only applied for a very short duration of time, but yes, they can be applied for if we are suspecting that this bleed, we cannot stop it by simply putting the gauze or putting the pressure over it. Other is hemostatic dressings which can be used to control hemorrhage as well. Now coming to the triage sort. Triage sort, it requires a degree of clinical training and uses a physiological measurement to score casualties and place them into priority groups. As I told you, if there's a mass disaster, for example, it's an earthquake, then actually the services, the load on the patients overrides the services which can be provided by the for different hospitals of the city. So then they have to prioritize that who needs treatment and how much he needs and who will benefit the most from the treatment. That's how the priority is done. Priority 1 is the immediate, priority 2 is the urgent, 3 which can be delayed over hours to days, and priority 4 is basically the patient is dead already. So the category of casualty does not necessarily dictate the order of evacuation or treatment. So that is important, because if, for example, the patient may need immediate care if he or she is having an airway obstruction, but the important point is we need to understand that if we have corrected that problem, is he or she is having so many other problems as well that he or she is less likely to survive despite all our efforts, then probably our efforts should be directed to a patient who is most likely to survive by the resuscitation methods. In this section, we have briefly gone through what are the actually modalities of what are the modes of trauma. Most common causes actually the car crashes or road traffic accidents, and now with the advent of cars, it is actually increasing. Initially, it was trimodal pattern of trauma. Now it's shifted to bimodal. But we need to understand is that the earlier the resuscitation and evaluation of the patient starts, the more likelihood of the patient to be having a low morbidity and mortality. So we need to have an organized system in form of emergency medical care teams who can quickly assess, evaluate, and resuscitate the patient and bring it to the hospital. Keep watching sqadia.com. Thank you very much.